Governor, thank you so much for spending time with us today. We really appreciate it.
You're welcome. Thanks for having me on your program.
You have framed medical malpractice reform as one element of an overall solution to the doctor shortage in New Mexico, and the bill you're supporting focuses on punitive damages. Why is that the best angle or an important angle to tackle?
Well, I want to talk about that because it's not the most important. It's a critical component. Punitive damages are the thing that isn't covered by malpractice insurance, but also spikes malpractice insurance, and it creates high personal risk for both providers, individuals, and hospitals. And we are a national outlier because we don't define it right. We have the lowest evidentiary standard for punitives. We have a weird glitch in how we define occurrence so that a single incident, which people should be made whole for if there's been a malpractice or an injury caused by a medical practitioner. But then everyone involved in the incident, whether or not they were responsible for the problem, you can do an individual claim for each of those. So it is ballooned and stacked. We also don't pay damages outright, which then impacts what you can get in punitives. And so all of a sudden, in the last several years, we have created a climate that is impossible for independent practitioners, and frankly, it's also impossible for hospitals.
Yeah, last week, lawmakers changed the bill to give more protection to individual doctors and local hospitals and less protection for out-of-state hospital systems. What is this distinction about? Is it about ownership or size or accountability?
It's really a debate, and I'll give you the side that I'm on, about these out-of-state hospitals don't have the same relationships, so they don't put enough staff in, and they don't spend enough money on the most clinical advanced treatment protocols and equipment. And then they create risk by doing that, and they should be held accountable. If we don't hold them accountable at this standard, we're never going to improve the quality of care. Now that sounds right, and I did a lot of that work as the Secretary of Aging, working with plaintiffs' lawyers, because I was worried about the quality of care. And we had a lot of out-of-state practitioners and nursing home owners. And you know what happened in the end? Until this country moves away from the perverse profiteering in healthcare, it is a much more complicated design. That means everyone's sold. That means there's one or two, like Genesis, for example. They've all declared bankruptcy. Nobody gets made whole. And guess what? They never hired staff and created new buildings. Care got worse. Rural hospitals will close. They've already got nearly $1 trillion out of the equation because of the Trump administration and Congress in Medicaid. They are not if the profit margins aren't good enough, and I don't even like saying that. It's just a reality. They won't hire people. They won't hire the best doctors. They won't invest. And so you know who is? You are. I've asked New Mexicans to pay for all of it because I worry about the quality of care. And in the end, it isn't enough because the doctors will not come to New Mexico. LFC report says 2/3 of all current doctors are considering leaving.
But is there a risk that these changes that leave the out-of-state hospital systems out of it will encourage them to leave or not invest?
No, I mean, the issue is that it doesn't encourage that, in my view. It just says the standards are the same. They're trying to exempt hospitals or out-of-state hospitals, and I'm not even sure exactly how they're defining that, from the caps now on punitive damages. If they want hospital accountability, they should continue to do the work in the new Healthcare Authority Department, which is braided and value-based investments. We only pay for outcomes. Medicaid is a huge tool, contracting, credentialing. There's a number of things. But that's not what's happening. This has really become a very personal battle between plaintiffs' attorneys and physicians. That is a very dangerous place for New Mexicans to be caught in the middle. And in fact, we do it differently, and I would suggest we're not doing it properly if you look at what's going on around the country. And here's another little factoid. We've created this sort of business of suing healthcare. And so you'll notice that you've got a lot of, and I'm not suggesting everyone does this, but some do, that they partner up with Texas law firms. You get a lot of Texas, California, New York, Florida. I'll tell you who is coming to New Mexico: out-of-state plaintiffs' firms. And there's a reason for that. Here's another one. You don't pay gross receipts taxes on those awards in Texas. So if you're partnered up, then our attorneys don't have to pay their fair share of taxes. So for me, it has gotten to be completely one-sided, and it's not about patients, patient protection, or patient care and access. Care delayed is the kind of issue that people lose their lives from.
But I want to talk about victims.
Yeah.
What do you say to a medical malpractice victim or a family who experienced reckless conduct or egregious behavior that punitive damages are designed for if this bill becomes law?
You still get punitive damages, and you should, because gross neglect is disgusting, and patients need to be made whole. But again, are patients being made whole, or is this climate of high punitives in settlements with costs and 2/3 of that award going to plaintiffs' lawyers? Are patients being made whole? Talk to the individuals with plaintiffs' attorneys in northern New Mexico about FEMA. They ended up with less, no new houses, can't afford their land, but lawyers made a lot of money. And so I'm a lawyer. I need plaintiffs' lawyers. It sounded a little too angry about trial lawyers. The problem is I need them to do their jobs, which are amazing, protect people, make them whole. But you can't practice an environment that, for whatever reason, got so one-sided, including the way in which we calculate what the costs of care for the future or what you lost is completely different than anybody else, and it's designed so that it weighs in favor of the plaintiff's attorneys. It should be weighing in favor of the victim and the patient, and it isn't. So what I'm asking the legislature to do, and New Mexicans, is don't take a side between doctors or patients or lawyers. That's an untenable thing to ask anyone to do. I'm asking New Mexico to right-size our laws to make sure that patients can be protected, which is why we have a patient compensation fund and why we keep making sure people have access to insurance, because we want patients to be protected and have access. But we want this to be a reasonable setting so that everybody's held accountable, but everybody has a fair situation from which to practice.
So if the sort of package of changes that you want goes into effect, how will all New Mexicans kind of notice the difference? How will that impact them on a daily basis?
Well, I think one way is, I think your physician. I mean, I'd be surprised if there are any patients that go to see their doctor or their practitioner and they don't hear about malpractice and the climate of care and their insurance. I'd be very surprised if you haven't already felt like that's an issue. I'd also be surprised because people are telling me, and I have the same issue, you can't get in. I've got a family member that's on a 2-year wait list for a pediatric specialist for urology. I mean, it is not easy for any of us. You should start to see a sense of, I feel like we can recruit docs. There'll be a change in the medical schools, sort of advice to residents about where they go. Our medical compacts are also being passed, which means that we've got reciprocity for licensure. We've been retraining the boards. We're going to do better advertisement, and we're going to keep the stuff going that we have that is good, like this fund that sort of balances risk. And we're going to make sure that we still underwrite malpractice insurance because it's really expensive for OBGYNs. New Mexico pays, if you're an independent practitioner, 100%. So I think you will begin to see quickly a change in attitude, a reduction of the temperature, and the state will be in a much better position to recruit providers.
Now, it's not a sure thing. You
No.
have said, I'm not leaving this job without medical malpractice reform, but state lawmakers have been resistant to special sessions. So if it doesn't happen, you've said you're willing to apply pressure. What does that look like?
Well, now I'm going to disagree with you. That's not really pressure. That's doing my job. New Mexicans, 85+% want this. They believe that they are experiencing poor quality care because they don't have access. And they are all concerned that their doctors are leaving. This is not good for the state. It's not good for families. It's not good for economic development. It is not good for anyone. So what I have said is you have to address it. That's your number one job, is solving problems for New Mexicans. It's a contentious issue with a lot of parts and a lot of complexities. The difference this time is you have a lot of people who are really clear that something has to give. And as long as it doesn't have a fatal flaw, they have a chance to get it up to me in a 30-day session. If they don't, here's the big difference. You have some moderate Democrats. You have 100% of the Republicans in the House and in the Senate who want to stay or be called back for a special session. This is their number one issue. That changes the climate for any governor, and it certainly changes the climate for me. So I would say, not pressure, but I've made it clear I won't shy away from creating the necessary pathways to make sure that this number one issue gets addressed. I don't have that same situation for some of my public safety packages, so calling a special session for that doesn't change any of those outcomes. This would if it's necessary.
Governor, thank you so much for talking to us.
You are welcome, and can I add, this is a really important issue. This is where New Mexicans should, in a positive way, not in an angry way, weigh in. Call your legislator, tell them what your opinion is, and insist that they spend as much time as they need to on solving these problems.